This is Average Joe PT. We're going to talk about reducing pain, reducing anxiety through education, improving function within your home environment. Today we're going to talk about labral tears of the hip, what you can do at home to help reduce your labral tears, and hopefully get you back to doing your activities. Stay tuned. Let's get the skinny on this labral tear. Two types: trauma, you fall on it, or repetitive over a long time. You get out of the car the same way, you get off a forklift or something like that over and over again, and you wear the labrum down. Now that labrum basically is the outside of the socket where that ball fits in. It's nice and black around here. It works great. It's basically designed to give you stability to that ball, a little bit of suction in that area, as well as keeping things nice and lubricated so that you don't have any issues. The inside here, all nice and brown, that's another type of cartilage that keeps that ball so it doesn't wear on the socket. Now when you tear it, it's going to catch, it's going to pinch. That's exactly what it's going to feel like. And when you rotate your leg inwards, you won't be able to do it completely. It's going to hurt too much. When you try and bring your knee up towards your chest, it's going to pinch. It's going to hurt too much. So those are kind of some tall tale signs that we're dealing with a labral tear. Now you see the doctor might do an injection to see specifically if your pain goes away. He's going to then send you to therapy. If you come back and you're no different, no improvement at all, what they might do is they might do an MRI with dye to go and light that area up to see exactly where that tear is. Now, that MRI could be a false positive, because if you have some wearing within the socket itself, or if you have a spur on in anywhere that may be causing the pain, those two areas also can cause pain without the tear actually being any of the issue at all. Even though on an MRI it might show up as an issue, it might not be where your symptoms are coming from. I'm going to give you some positions that you can do, as well as some exercises within your home to help reduce the pain and inflammation. And hopefully, maybe if this is just an inflammation issue that's got everything irritated, and we can get those symptoms to calm down, and you go on your merry way, you don't have to worry about this anymore. So stay tuned. I'm going to give you some positions and exercises that you can do at home to combat this labral tear. Stay tuned. Position number one. You want to take either some pillows or a cushion in this case, and you want to put it down on either in your bed, or I'm just showing you on the floor. Put your leg right over the top and lie on back. That's going to unload. Now you might even have to take another pillow over the top. So that's going to take and unload and take all the pressure off of that hip, so maybe you can get some sleep at night. Like I said before, you're not going to want to turn that leg in at all, because it's going to pinch right in the groin area, and that's not going to feel good at all. So you might even get two cushions. The cushions are good because they're not going to flatten out like this pillow will. It's dense enough, and it's easy. You just take one or two cushions off your couch. You can always throw them back on the next morning. So that's position number one that hopefully will help. Position number two, if you can't lie on your back for whatever reason and you're a side sleeper, another position you can do is, I want you to take one or two pillows or the cushion, nice thick cushion, and put it between your knees. Now what I want you to do, now if you can't lie on that right side, you can, whatever side it hurts, right or left, you can go ahead and switch to the opposite side. But the premise, the idea is that you're not crossing over and causing that area to pinch in the groin area. So that's another nice position that you can do. As well as if you have a recliner chair, one of the things you can do is just lie in a recliner chair. Recliner chair will help you in regards to reducing the pain in the groin area. Now I'm going to go ahead and give you 3 strengthening exercises, because you're probably going to be weak in these muscle groups for your impingement or labral tear. Stay tuned. Exercise strengthening number 1. Now you can do this 2 different ways. You're going to stand with your hips nice and tall, and you're going to kick out to the side. Now you're only going to go to the point where you're not having pain. Don't kick all the way out where it hurts. in that groin area. So you're gonna kick out to the side. Don't lean. If you feel like you need to lean, come get a chair. Have the chair support you as you kick out to the side, or countertop, or whatever. Second way you can do this is just nice and tall and kick to the back. Just the point where you feel that butt kick in a little bit. Don't go to the point where it's hurting in the front, because you're going to keep that inflammation going and we're not going to get anywhere. You're going to stop doing the exercise because it hurts. So go to the point where it doesn't hurt. Nice little pause and then back in. Try like 20 or 30 of those because you're not using any resistance. And the same thing to the back. Now, the third one you're going to do is called a little bit of a mini squat. So you're going to use either a chair or a countertop, feet shoulder width apart, and all you do is come down nice and shallow. You're not going to go deep. If you go deep, you're going to start having the groin pain again. So stay nice and shallow, pause for a second, and then back up. That'll at least get all your glutes and everything engaged, but that can get kind of weak when you have this type of problem. So that's the 3 exercises, strengthening wise, that you can do at home for the labral tear. All right, folks, so that's some positioning exercises and some strengthening exercises that you can do. One caveat would be is some ice around the groin and the hip area. That will help reduce the inflammation as well as reduce the pain within that groin area in that socket. Now, if you have any comments, leave them down below, positive or negative. I'd love to hear them, and I can also put in discussions, and we can talk about a little bit more labral. I'm going to leave a link up below right here, and we're going to talk about some back issues. I put up one not too long ago in regards to some muscle groups that in your lower back that can also give you some pain, and some techniques that you can do at home in regards to some tightness and back pain. So I'll leave that link for you. And until next time, look up and keep smiling.